am originally from Guatemala City, and my family moved to Jacksonville 5 years ago. One of my co-fellows, Dr. Warda, he also talked to me about the program and the strengths of the program, how he felt really welcomed and how they had like a family environment. So yeah, I applied and I kind of like realized that all his words were true.
I did my residency, internal medicine residency here, also at UF Health Jacksonville. And I've gotten to know and work with the attending in the endocrine fellowship prior to becoming a fellow. The faculty members value teaching, value graduating good fellows that will serve the community. And I saw how robust the training is while working in the clinic and inside the hospital.
It's really important that we maintain a high level of camaraderie. We want to maintain a high morale amongst our fellows. We treat them with respect and fairness. We want to make sure they understand that they are here to learn and not just do the work.
We're a small core faculty, around 4 or 5, so the interaction one-on-one is almost on a daily basis. We help each other. When I introduce my fellow to my patient, I introduce them as my colleague, not my fellow.
It feels like a family. I know a lot of programs say that, but I think each attending has their own areas where they are basically experts, so areas of expertise.
Our attendings are so experienced. Everyone has their own area of interest and special knowledge. I don't feel shy to call them up even after hours to ask questions, and so I really appreciate how approachable everybody is.
They're basically role models, so in endocrinology. Yeah.
We're a program that helps to grow clinical endocrinologists. So we have endocrinologists that are interested in all of the various areas of endocrinology. And so because of that, we're able to learn together. We also provide basic as well as clinical research through Dr. Haas. We also have performance improvement projects that help the upcoming clinician to become better at their own practice.
This is a unique program in this way in that you get the research, but it is a different kind of research. We have basic science research. Teaching them all these techniques, and especially the newer techniques that are coming out with next generation sequencing and CRISPR technology, all these things, you know, it's a challenge for me too. And so it makes me grow in the field. So I very much enjoy it.
All of our attendings also encourage us, we have a special area of like passion or interest in order to help pursue that. I'm particularly interested in post-traumatic hypo-PIT patients, and so my attendings are helping me get more involved in TBI studies.
Jacksonville is a great place to be in. Obviously, it's in sunny Florida, where we are right by the ocean. We have the St. Johns River that runs through downtown, so as you can imagine, there's plenty of water activities, water sports, wonderful hiking trails, a lot of outdoor activities to be taken advantage of. Golf is abundant. We are lucky to have a professional football team, and because of so many healthcare systems in the area, once our fellows have graduated, they have the opportunity to practice in the community, which they've grown to really love, and it's a great place to raise a family.
We have complex and challenging cases that will prepare you for the future, but you also have what we call bread and butter, the everyday cases you'll see as an endocrinologist in the future.
We work with a diverse patient population. We are a safety net hospital, and that gives us the opportunity to work with some of our most vulnerable adults. They also get a feel of a suburban community practice in some of our outpatient clinic experiences. So they really get a broad spectrum in terms of their clinical training.
I feel pretty confident at this point, moving back down to South Florida, that I have been exposed to not just the diversity in patient cases, in endocrinology cases, but also diversity in patient ethnic backgrounds and socioeconomic statuses that you see in an urban environment.
And I think that's what makes the program a little bit more favorable in that whatever is thrown at you in the future, you're ready. And whatever challenge comes your way, you can comfortably say, I've seen this before.